and welcome everybody to our Autism Exploration Series. I'm Dr. Emily Sampone. I'm the Director of Clinical Operations here at Verbal Beginnings. Verbal Beginnings' mission is to change lives for our clients, families, and our professionals. We do that through our pledge of care, our promise to you, to provide effective treatment through compassionate care. And we also strive to achieve our mission through our core values. One of our core values is education, teaching families valuable ways to work with your child. And that's why we decided to start this series. Additionally, you'll see the seal for the Behavioral Health Center of Excellence, as well as the seal for the Autism Commission on Quality. Both of these seals represent the hard work and focus that we place to ensure that VB is providing quality care through our highest of standards. Next slide, please. I also want to take this opportunity to introduce you to the services that we offer here at Verbal Beginnings. In addition to our in-home and center-based ABA services, we also offer center-based comprehensive services, feeding therapy, and social skills programming. Additionally, we encourage you to participate with us today throughout the presentation by using the Q&A feature found at the bottom of your screen. We also offer closed captioning during this recording, which you can access by navigating to the bottom of your Zoom screen and clicking the closed captioning button on the bottom of your screen. Okay, without further ado, I would like to introduce you to our presenter for the evening, Ben Sarcia, our Clinical Director of Healthy Beginnings. Ben, it's all yours.
Thank you. So just really quickly, because about me and who I am and why I'm able to present to you all. I appreciate you all attending because I love to talk about this topic, as I was stating it when we first all signed in. But so I've had a variety of experiences with feeding therapy, including in outpatient clinic settings and hospital setting. I'm currently working on a dissertation to see if we can find a way to make behavioral feeding therapy a little easier for challenging kids. So stay tuned on that one. But one of the things to note from my list of items here is that I am not a registered dietitian, and we're talking about nutrition. So throughout the presentation, I think if you have specific questions related to intake of nutrition and deficiencies and so forth, that it would be really great to consult with someone who is a registered dietitian, because they're going to be the ultimate authority and not me. But this presentation, I just want to share. The content comes from peer-reviewed journals, and I actually initially created it as a continuing education event for behavior analysts and other professionals. So when we're looking at the articles that were included in this, they've achieved a level of scientific rigor. They're not hearsay, they're not anecdotal information, they're legitimate studies, and that's why they're included. So 80% is the number of children that is believed to be, as far as having autism goes, number of children with autism having a comorbid feeding issue. So whether that's issues with food selectivity, texture selectivity, such as only eating crunchy foods or only eating pureed foods, or even lack of self-feeding skill or ability or behavior, that all falls into that number. So that's incredibly high. But it's also important to note that there are plenty of children that don't have an autism diagnosis that also display similar feeding issues. So opening it up here, first poll question would be, do you have concerns about your child eating enough of different varieties of food? Okay, so yes, that makes sense. And 85% have that concern. Great, okay. So delving into nutrition, let's review some of the basics. And forgive me that this will come back to your middle school or high school science class or health class. But I thought it was important to kind of go over some of this information and review it if you're a little rusty. So the definition of nutrition includes the process of providing or obtaining food necessary for health and growth, which includes proteins, fats, carbohydrates, vitamins and minerals, fiber, and then of course water is really important. So not spending too much time on this slide, but considering that proteins are the structural and building blocks of cells. So it's really important to have quality protein intake to produce quality cells, which run the body. So these come from meats and yogurts and cottage cheese, things like that. And then, of course, there's fats, which are really important for young children and developing brains, and where you might hear about like consumption of omega-3 supplements. But naturally found fats are naturally found in avocados and nuts and fish. And then, of course, carbohydrates are a big source of energy found in fruits, vegetables, and grains. Vitamins and minerals, I note here, regulate the metabolism, but they really help with repair of the body. So obviously, we want to make sure that there's good intake of those items. Fiber, so important and commonly deficient in children with autism and children that have no diagnosis at all, but basically responsible for ensuring that waste is transmitted through the body. And that's where that consumption of water and enough liquid to help with that transportation is really critical. So consumption of avocado, berries, lentils, beans, broccoli, these things are high fiber items that are important. So then when we look at nutritional deficiencies, basically this is a definition of an inadequate supply of nutrients that then leads to malnutrition, illness, developmental or growth complications, and oftentimes diagnosed via a blood test for specific nutrients. Are they present or are they not present? Or is not enough of that item present in order to determine the deficiency? Some disorders, such as Crohn's or celiacs, may also be tested for as well. And that's we're going to talk more about elimination diets too, and where those conditions might be implicated. But when considering the diagnosis of a nutritional deficiency, we could also potentially look at BMI. Again, this is where a nutritionist or a dietitian is going to help you. But doing assessing changes over time. Assessing changes in BMI can tell us if there are nutritional deficiencies and also give us information into things like obesity. So then, of course, the potential consequences of a nutritional deficiency not being addressed include, bruising of the skin, bleeding, seizures, anemia, goiter, hypertension, growth failure, growth deficiency, illness, disease, all things that I'm sure any of us don't want our children to be subject to. So then considering excess nutrition, that's really important to evaluate as well. And oftentimes this is not intentional, but basically it's an overconsumption of nutrients, including vitamins and minerals, that leads to adverse health effects. Sometimes this is done from supplementation. Other times it's, a child or an adult who just eats too much of one thing. So I'll give an example. Something that we see that I think has a really, kind of more clear outcome is that in clinic, we frequently have children that where they consume too much milk. And basically, the body can't break down the lactose quickly enough, leading to digestive issues such as constipation or diarrhea. Can have an impact. A nutritional excess can have an impact on metabolism, which then can impact growth. So again, diagnosed similarly to a nutritional deficiency. And then consequences, there's just a few here. So looking at some findings, and this is some key information related to autism and nutritional status among children with autism. So this is a 2012 article, and basically it identified that selective eaters, which are common with developmental disorders, are likely to be at risk for deficiencies, which I don't think is a surprise, but this publication proved that somebody who has a limited variety, perhaps they've eliminated one or more food groups, would not have the best nutritional status. And so surveys indicate that the variety of foods accepted by individuals with autism is lower than that of same age peers who are considered to be neurotypical if there hasn't been any kind of treatment provided already. It's also been found that consumption of vitamins A, C, and D, as well as calcium, are lower than that of peers when it comes to the autism spectrum group. Calcium and vitamin D deficiency were also cited, and I found a couple of, well, at least one publication that talked about this being related to the popularity of elimination diets, such as the gluten-free, casein-free diet, which again, we're going to talk more about. One study found that the group of ASD had a lower bone density. This was a 2008 study. So that's an important finding as well. And then, as I mentioned earlier, the consumption of fiber is often insufficient. Potassium is insufficient as well. But that fiber thing, like I said, is common among so many children not eating enough fruits and vegetables and getting enough fiber that way. So I think the main point I want to make with this slide is that, your child's health, growth, and development may be impacted by deficiencies, and then, you want to seek professional help before that there's a serious consequence associated with those deficiencies. So just to kind of quickly look at some different examples of associated conditions. So some of these I feel like sound from like an old novel, right? Like rickets, was common on people who were traveling across the Atlantic Ocean in the 16 and 1700s, and there wasn't enough fresh fruit, or scurvy rather is the one I'm thinking of. I was jumping ahead, but so these are really important, and I think these are important complications to consider, and certainly being able to avoid them because they are serious complications. And so here's a case example. And so basically, Kinlan, Vresk, and Freeman reported on a 10-year-old in Canada with autism spectrum disorder in 2018 that actually went blind. And when they took a closer look at this child, they found that he had a very poor diet, which consisted of chocolate bars, buttered popcorn, French fries, fresh buns, water, thankfully, and soda. And so they implicated a vitamin A deficiency, which resulted in xerophthalmia. So you can see here on that slide that potential eye infections that leads to blindness. And so the treatment was a vitamin A supplement, which was challenging to actually have the child consume that supplement because of the restricted oral intake. So basically, the child had a behavioral feeding issue where they were absolutely refusing to eat anything but those foods that I mentioned, which then made it really difficult to provide that treatment for the xerophthalmia. So the author's conclusions in this publication were that the child, was in desperate need of a behavioral feeding treatment program in order to teach them to learn to accept a variety of different foods.
Hey, Ben,
Yes,
question that came through. Do you want me to ask you now?
sure.
Okay, cool. So this participant mentioned that they're very concerned with their 3-year-old autistic son who they're fearing is not getting enough fiber. They said he eats about 10 different food items, none of which are in high fiber. Is it
Mhm.
safe to provide fiber supplements such as something like Benefiber? And they mentioned that he will not eat any of the type of like fiber gummies. So just thoughts on
Yeah.
that.
Okay. So I think, again, not being a dietitian or the authority, but I think, fiber supplements are pretty common. It would be interesting, and actually, I haven't found anything that like really looks at, how common is Miralax used for children with a developmental disorder such as autism spectrum disorder. I know that my own children's pediatrician has said like, oh, everybody should use a little Miralax, and I'm not entirely sure that that's true. But those products are pretty safe, especially when variety is so limited. So I think you can definitely have a conversation with your pediatrician about a supplement such as Miralax. That's the most common one that I encounter. Benefiber, I don't know as much about. There are some other different supplements out there that, again, I just don't know enough about. So again, a conversation with the pediatrician would be helpful. Having used Miralax with my own child, I will caution, maybe start small. I think I started with like half a capful added to his water every other day. So that way you don't want to go full in because then you can have the opposite effect, which is some really loose, frequent stools. And if you're like me, your daycare will not be thrilled. Thank you for that question. So we assess nutrition by looking at the variety of foods consumed. So that might be the caregiver keeps a food diary, looking at the volume consumed, or even just an estimate I know is helpful for me. Looking at urine output, the color of that urine, how much bowel movements, frequency, if ideally your child should be having a bowel movement every day. Every other day is okay, but not great. I met a child recently that was like twice a week, and I was really mortified to hear that because it was also very apparent that the child was really uncomfortable, and that impacts learning and daily functioning, and how you feel impacts how you get through your day. So considering consistency, frequency, and then of course weight, as I mentioned before, looking at that growth trajectory. So um, one of my former dietitian colleagues at the Kennedy Krieger Institute used to frequently talk about bouncing on the growth chart, indicating inadequate nutrition, and that we really want to see a stable trajectory of growth. So if you have concerns, definitely speak with with a nutritionist or a dietitian. Um, if the child then won't consume the foods or supplements or vitamins that are recommended by that person, and that's really where someone with skill in behavioral treatment of a feeding issue is going to offer you the most help. So this is what I'm referring to as an ABA based feeding program, because ABA has repeatedly been demonstrated to have strong empirical results that make a difference and really help avoid more significant issues.
Ben, there
That
was a
Mhm.
question around
Yep,
bowel movements, if we
sure.
want to answer that on this slide.
Sure.
Okay,
Let's get into it.
let's get into it. Okay. What if my child is having 4 to 5 bowel movements a day? Does that mean that they're having too many? What would be considered normal? I'm not sure if this is within your realm, but figured I'd ask.
So it's probably not within my scope, but we're going to talk more later about potential. I think it never hurts, if you haven't already, to see a GI. And I know that's an added step, and most parents, already have so many things that they need to do. But I'm going to talk more later about why that's really important. Good question though, and I've got a slide for it, so I can speak to it more later. I also want to highlight here, as I was speaking about ABA-based feeding interventions. Certainly, there are speech and occupational therapists that work with feeding issues as well, and I think it's really important to highlight interdisciplinary collaboration. I know in my own program, Healthy Beginnings, we have speech and OT that works with us. And it can be really important. We have children that have really limited their variety because they can't chew food, and they just kind of stuck with textures that are safe for them. So that might be foods that easily dissolve, like veggie straws, or it might just be purees. And that's where we will work with the speech therapist on finding the safest strategy that combines that skill piece that speech is offering and that behavior piece that we're looking to address, to teach the child to properly chew food in order to expand their variety. Just as a quick example there. So then, potential influences on nutrition, right? And so, again, this is related to ASD, but it could be with a child that's completely neurotypical and has no diagnosis. So looking at selectivity by, texture, the food group, the color of the food. We meet children that only eat beige foods. That's a common one. Um, the brand of the food. So this got really hard during the COVID-19 pandemic. And I always, whenever I talk about this, we had multiple parents who called us and said, we can't get the Tyson fresh dinosaur shaped chicken nuggets anymore. We can only get the frozen regular Tyson nuggets, and my child won't eat them. And I know we should have gotten feeding therapy before, but supply chain issues we weren't counting on. And what do we do? Right. So brand can really be a problem. At the same time, I've seen temperature be a problem. And I think it goes to go without saying that most people don't like to eat cold food. But I've had children that won't eat food unless it's piping hot, and the parents are like, school doesn't do heat ups, so they won't eat anything while they're in school. Or I've had kids that won't drink milk unless it's room temperature. And so, that milk coming out of the refrigerator then has to be warmed, or it has to sit out. And then preparation of the food, whether it's, how it's cooked. Or I note here, I've had plenty of kids that will eat grandma's scrambled eggs, but anybody else's they just won't touch. So whatever magic grandma has, um, she must have something there anyway, that she's figured it out. But we do meet those kids that are really specific. The type of feeder as well. So if that's, presenting the food to the child and saying, I want you to eat that yourself, and the child saying no, and then the parent finds themselves having to feed the child. Um, and then of course, the setting where they'll eat, considering the type of utensils and plates and things. If you have to carry a specific plate with you, that can be problematic. And so ultimately, this list of items can lead to failure to thrive, which is when growth is impacted. Additionally, we know that there are impacts on social activities. So, common thing I hear from parents is, I want my child to be able to go to a birthday party and eat the pizza or eat the cake that is being served at the birthday party. And I totally get that. And here we are having a talk about nutrition, but what's wrong with eating cake, right? Every once in a while, and working towards that. So I always encourage parents, like, sure, you want to work on ice cream, bring it into the clinic. We can include that into our list of foods that we want to work on too. We also know that research has confirmed that the food selectivity of one family member can impact the entire nutritional content of the entire family. And that's as simple as parents get tired of making multiple meals, so they start sticking to the food that they know that the food selective child will eat, and so everybody else ends up eating that too. So that can definitely be a problem. So looking at some common supplements. So these are things I just wanted to make a kind of a short list here, because these are things that I hear when parents come to me and they say, oh, my child has autism, so I think that they should start taking these things, but they don't really know enough about them other than they've heard that another caregiver has recommended, or they read somewhere that these are important, or they read on Facebook that this is omega-3 is necessary. So here's just kind of a quick look at purpose. So like, I'm only going to pick on a few here, but like vitamin A described as improving overall behavior. So that's really just kind of a general assertion, not necessarily a valid finding. But so what does the clinical research say? Improvements in language skills and eye contact in 2 children with ASD. So that's really limited, and that tells you that study needs to be replicated further, but that's definitely a promising result. However, what we also know about vitamin A is that it's easy to get carried away and over supplement that. And that's where we've heard of families who have read these claims and said, oh, well, we're gonna take vitamin A every day, leading to toxic levels of it in the body. So again, consult with a dietitian before starting something like this.
And I have two questions for you.
Sure. Yep.
Okay, first one. My son also has seizures, and the neurologist suggested a ketogenic diet with limited
Mhm.
choices of the food that he eats. I have not explored this yet. He eats mostly chicken, fries, pizza, some fruits, bread, and rice. Any recommendations on how to help a child adhere to this type of diet?
I think the ketogenic diet is really hard. And I've seen kids who have had seizure disorders that are not amenable to medication. And that the ketogenic is kind of the last option, but it's also a really limiting diet. So I think ongoing consultation with a dietitian in coordination with a neurologist to make sure that that diet is actually working is really important. But also, I've seen where it's really hard to maintain adequate nutrition with that diet, though I have also seen firsthand experience where it's been successful in reducing the frequency of seizures. So I think the last part of that question was, what do you do if the child won't eat those foods?
Yeah, I was just adhering to that new diet
Yeah.
since their diet's not keto right now.
So, I mean, that's where I would say you want to consult a behavioral feeding program to work on increasing acceptance of those foods, which might, just start gradually, and you work your way up to the proper volume of those foods to be effective, or hopefully be effective towards reducing the seizures. But that might be something that you really have to do kind of gradually, because you wouldn't want to just cut the child off from the foods that they do eat, because that's going to significantly impact nutrition and caloric intake, and I've seen that happen, and it's really sad. So don't do that either. Second
You ready
question.
for the next one? Yeah.
Yes, please.
Okay. What are your thoughts on light orange juice with calcium and vitamin D and light juice in general, such as Honest Kids, for a kiddo who won't drink milk anymore and doesn't seem to drink enough water? Do the downsides of juice outweigh these benefits?
I would say I'm not the authority to answer that question. What I have in my experience, when I was working on a daily basis with a whole nutrition department in a hospital setting, what we would frequently do was flavor water with some of the like Crystal Light type options, because I think they're a better alternative than doing juice. And admittedly, I don't know enough about the light juices and if they're a better option or not. But I know that's what the dietitians used to recommend, where those you can get those kind of like the squirt ones or the little packets too. That might be a good option for the child that just won't drink water. I really like that question though, and now I'm going to have to ask it to my dietitian friends. So I want to emphasize here, taking caution, and this information comes from an article titled "Dietary Influence on Autism." But so, like I was saying, it's possible to over supplement. You can have too much of a good thing, resulting in side effects or unintended complications, other health difficulties. So, like we talked about, excess vitamin consumption. So even here, some supplements have reactive effects. So zinc, for example, this supplementation reduces copper concentration in the body, which can result in anemia, fatigue, joint damage, and more. So really important, especially be careful when testing on yourself, because I found at least 2 articles that talked about supplementing in children with developmental disabilities, but parents trying them first, which I guess is good that they did, but they found that that resulted in complications in the parents as they were trying them, that they didn't consider there being an adverse impact to themselves. So again, consulting with the proper authority, I think is helpful. And then I'll get into some controversy here. So I pulled this from Facebook over a year ago, but basically it was for a miracle supplement that promised major improvements in your child with autism's behavior, and basically stop short of using the word cure for autism. But I love that this person asked the question: is it backed by field research? This supplement that they were trying to sell. And so somebody, which again I appreciated, took it among themselves to say no. But the author, this company, and I have no idea if this company is still in business, basically said, "Oh, we don't have clinical trials. We're selling this product. We don't have clinical trials, but the products in them have had clinical trials, not together in the product that we're selling, but they have had." So that's where I would say, look for these kind of things, ask questions, not related, but not related. But I had a family come to me, and they were really mad that I wasn't using the vibrating oral stimulator that they had spent all of this money on. And they had been told by another therapist that was how their child was going to learn to accept food, and he was completely tube dependent. And I said, that doesn't make any sense. And so ultimately we went to the company and said, well, what are the instructions for this oral stimulator? And they said, oh, well, we don't have instructions for it. We just sell it. That kind of thing is generally a sign that what they're selling to you is the snake oil, that it's not real. It's a good money-making product, though, I'm willing to bet, or they're hoping it's going to be. So then let's talk about probiotics, supplements, and ASD, because I know that these are more common. Probiotics are increasingly common outside of the realm of ASD in general gut health. And so there's some neat studies, there's some emerging research, there's a long way to go from what I know about it. And I could be out of date, I don't know. But so looking at this first study by Shaban and colleagues, so basically they took stool samples from 30 children with diagnoses of autism spectrum disorder, and they really wanted to assess the good bacteria content in there. And they compared it to a non-ASD control group who also received the probiotic. And what they found was that children with autism and without, who had diagnosed GI issues, that the probiotic intervention produced clinically significant results. So basically, if the child had a condition, they had the pathology, that the probiotics helped this. If they didn't have a diagnosed issue and it wasn't real, they didn't have it, then the probiotics were not determined to produce any kind of meaningful change. So ultimately, we know that proper nutrition and supplementation can be beneficial. It's just unclear. Is it equally beneficial for everyone? Probably not. Are there things that are more beneficial than others? It's looking that way, and it's sometimes hard to parse out or determine where's the most benefit. And so again, supplements will likely be the most effective when there is identified nutritional deficiency or an associated condition. To clarify further, if your child doesn't have an identified vitamin A deficiency and you're just giving vitamin A and hoping it's probably not going to be helpful. And as I mentioned, it can be harmful.
I have a question for you that came through.
Okay.
My son has a huge oral input need and loves pop, which I believe is soda. Do you have
Soda.
any good alternatives? We tried Poppy and thought maybe the probiotics are good for him, but we are not sure.
I don't have an answer to this question. I'm sorry.
That's okay.
I
That's
am
okay.
also was born in the Midwest where we called it pop, and so it's good to hear that. I wish I had an answer. Thank you everyone though for the questions, because I feel like it is nice to have interaction, and years ago we used to do these things in person, and obviously we're able to reach a lot more people now. So elimination diets. Let's do a poll here to see how many people have tried.
Fun fact that came through is that they also call it pop in Canada.
Do they really? Huh.
That's what I got through here. I didn't know that. That's a really fun fact.
Well, and I grew up in the Philadelphia area, but I went to school in central Pennsylvania, and so I met a lot of Pittsburgh people who I believe also called it pop.
Huh.
Mhm.
Learn something new every day.
How about
Um, do you want to answer a question while this is still being filled
certainly?
out?
Yeah.
Okay. Is a general multivitamin a good idea for school age kids who are prone to coming home with every germ possible?
I think so. It's not, as far as I understand it, it's not a replacement for, a healthy immune system, but I do think it helps maintain those systems that will support an immune system. And I would hope that if there are any dietitians present, that they would agree with what I'm saying. But it's not like, as far as I know, people who use those emergency things when they're already getting sick, like it's not going to help you in that regard. Okay, have you implemented an elimination diet with your child? So 83% said yes. I'm so surprised. 10 out of 12. Wow, that's so many. Okay, really good information. So you're proving my statistic wrong here that I have. Let me go back so I make sure I read it right. But it's that estimates indicate that 25% of children with ASD have been placed on some kind of elimination diet, and they appear to be very popular, but the results or the popularity of these diets, I believe, have been waning in more recent years because the results are inconsistent. And I will caution here that these diets are very dangerous if not implemented properly. So please listen carefully. So, theory behind elimination diets, and let me just preface this with, I think that they became popular because people had true success and parents shared that with other parents who then were hoping to see the same kind of success. So the idea is that proteins enter areas of the brain in which they shouldn't access, resulting in aberrant behaviors. The idea being that perhaps this is amplified with children with autism spectrum disorder. Years ago, well before I was a behavior analyst, this was probably like 15 years ago or so, longer, the leaky gut was common. This is another idea, basically being that saying that, oh, the child was having not properly digesting, or they had a malabsorption syndrome that was resulting in toxins or undigested things going to the brain and impacting. There were huge GI issues, and there were brain implications that were the reason why the child was having features of autism. Putting it, I'm sure the other people would describe it differently, but that's how I've always interpreted that. So I haven't heard of leaky gut in a really long time. But decades later, it continues to be a theory and it's lost popularity. And there I was. I didn't click forward. I started talking. I'm sorry. So getting into the gluten-free diet, because I will argue that this is the most popular, or the one that I hear most from families. And so basically, it's commonly used to address, and usually effectively, celiac disease, wheat allergies, or autoimmune disorders in which gluten has been implicated as the cause of symptoms. It's not an allergy, it's an intolerance. So before implementing a gluten-free diet, the child or adult should really have a formal diagnosis made by a qualified professional. So if that's going to see a GI, you might see an allergist to rule this out and determine if this is an appropriate condition. But if you did, that's where you would implement the gluten-free diet, which is an elimination of food and drink containing any kind of gluten. So oh, I should mention too, I forgot. So how do they do this? So you might have an endoscopy, is what I'm told. But then also there could be a blood test or a stool sample to diagnose a gluten intolerance. So then what grains are allowed? Because remember, we want that well-rounded diet. Rice, corn, quinoa, buckwheat. So these are things that you could work on replacing those other high gluten content items such as wheat. So then looking at the casein-free diet, so talking about dairy, this is a dairy intolerance. So again, a formal diagnosis should be made. This is implicating a lactose intolerance. Lactose is the sugar found in dairy products. Lactase is the enzyme that breaks down lactose. So if lactase is deficient, that's where problems happen. And that lactase is found in the cells of the small intestine. So the intolerance comes from not having enough of those cells. And actually, I learned when I was drafting this presentation that it can emerge at any point in life. So if you don't have it now, it could happen later in life, I'm sorry to say. Hopefully not, though. Something else I learned, though, is that ice cream has a high fat content. So you can actually hear about people who have a lactose intolerance, but are able to tolerate ice cream because of that. So then what substitutes are available? This is where you get into like the soy, the coconut milk, almond milk, which if you work in a facility like I do, that's nut free, that's a real drag. But there are different alternatives there to consider now. I know that there's different pea protein milk and things like that I truly just don't know enough about. And then there are calcium-rich foods that don't contain lactose. Something I'm realizing I forgot to mention about the gluten-free diet, of course, is that a lot of foods that are gluten-free are not fortified, whereas there are plenty of foods that contain gluten and are common grocery store products, such as, boxed cereal, that are fortified with vitamins and minerals. And that's where the gluten-free diet can be really dangerous because of the potential for nutritional deficiencies, because in America, we have children commonly don't consume enough fruit and vegetables, and we rely on fortified foods to supplement that. So consider that the next time you're at the grocery store or arguing with your child about eating broccoli. So then looking at research to support the elimination diets. So Susan Hyman is a researcher. She's an MD, neurodevelopmental nutritional researcher. I've probably butchered her title, but I've attended several webinars for her. She's got some great publications, and she's out of the University of Rochester. So I've used some of her research to inform this presentation, but she's really got some fascinating work, and I think it's really important that this work continues, especially as families, continue to be told, hey, you're really going to benefit from an elimination diet if your child has autism. But so basically, Dr. Hyman emphasizes that a confirmation of celiac disease is really important, when considering something like the gluten-free diet, as I was stating. I think really interesting, and I found basically I found no research to support that there were any kind of improvements that if a child with ASD that didn't have a specific diagnosis started on a diet, if there was an overwhelming change in symptoms or ability to function or learn or participate or speak. So basically, and sorry, I've jumped ahead of myself. But basically, if the child didn't have a diagnosed GI condition, employing these diets really wasn't productive. It wasn't helpful, and in some cases, it was potentially harmful. So, if you have a question about the value of these diets, I would first start with a GI. I also want to talk about functional medicine a little bit because these practitioners are out there, and I had a couple of families in the past month, which surprised me because I haven't heard a lot about functional medicine recently, but basically saying, oh, they did testing and they prescribed all these supplements and elimination diets, and these parents were just saying, should I do that? And I think the best thing to do is be skeptical, especially when expensive supplementation is being recommended. And I think, if someone is saying, okay, you need to start this elimination diet, and so the common thing I hear is, there's too much yeast in my child's gut, so you should definitely go to a GI. Go to a GI and have any of that testing that's done by another discipline. Have them repeat that testing and confirm that they're seeing the same thing before you implement any kind of dietary change, supplementation, any kind of intervention like that. That's the best advice I can give. So should all children with ASD then be tested for GI dysfunction if we already know that there's a higher prevalence of this among children with ASD? And so basically this 2010 study said we're really not sure, but they did identify a 5-year-old boy with autism as having a malabsorption syndrome, and intervention resulted in a reduction of autistic symptoms. So basically there was an elimination diet that resulted in improvement of symptoms that were causing problems and impairing the child from learning and making progress towards things like IEP goals and things like that. And so their recommendation was for the children with displaying any kind of neurodevelopmental pathology to undergo testing for nutritional deficiencies or other GI conditions. I'm not sure how insurance companies would feel about that. But I think you could potentially make the argument that if the long-term implications are that a child who is in school or perhaps, receiving speech therapy or ABA therapy, that those therapies and the money that's being spent and the time that's being spent and the effort that's being exerted by the child as well to participate in those therapies would be more valuable if they have the best health that they possibly can. And ultimately, that should result in a reduced cost over the course of that person's life. I would think anyway. But I'm certainly not an accountant for an insurance company, so I won't try to be. So I think a key takeaway here, as I was saying, seek an opinion, especially if you're working with a provider who's telling you these things that maybe don't sound entirely true or that are questionable. Definitely seek a second opinion. When it comes to nutritional deficiencies, it's really important to work with a nutritionist or a registered dietitian. Somebody who has experience with autism would be ideal, of course. Some insurance companies will pay for this consultation. I know here in Maryland, I believe, I'm not a Kaiser Permanente member, but I believe that they have members do have access to a nutritionist as part of their plans. And then, of course, if you're worried about the limited variety of foods accepted, having a behavior analyst come up with a plan that works for the child and for the whole family and that can be applied across settings, so potentially in school, that's really important. Some situations are harder than other. We meet kids who, need just kind of a simple exposure to different foods, and sometimes having that unfamiliar person of a therapist can kind of talk them into it or offer the right reward. And we have other kids that will lay on the floor and kick the door until it's time to go home. rather than take a bite of broccoli or macaroni and cheese or whatever it is that we're working on. If there's a skill deficiency, which can go along or contribute to a behavioral problem related to mealtime, that's where you want to include, usually a behavior analyst, a speech and language pathologist, an occupational therapist working together to work on those skills and the right combination of behavior principles to teach the child what they need to do in order to become a more independent eater. And then certainly if you have concerns about digestion, gastroenterologist and allergist, sometimes it's important to see an otolaryngologist or an ear, nose, and throat doctor, especially if there's potentially a concern about swallowing or some kind of inflammation of the esophagus can happen without people even realizing. But again, a GI or an allergist should be able to help you identify something like that as well. And then certainly concerns about swallowing, you would want to work with a speech and language pathologist, an ENT, if there are some questions about the ability to swallow food or drink. And I will open it up here to questions. Oh, before we get to questions, I forgot I added this slide and I think I put it in the wrong order. I just wanted to show this because there's not very many interdisciplinary feeding programs in the world. So I put my own as number one here in Columbia, Maryland. That's Healthy Beginnings. But you can see most people have to travel to access these. So like there are some other out there. I know that there's at least one in California. I just don't know where that it is or how big it is. But you can see there's just not a lot out there as far as being able to access legitimate interdisciplinary feeding programs that are truly qualified to provide meaningful help to children and families. Questions?
That was a really cool slide that you just presented. I didn't
I
realize.
don't, I just thought it was cool because people say to
It's
me
a
all the
new
time, like, oh, we have to go to Columbia. And I'm like, well, it's not
one.
as far as if you lived in Nevada.
This is true. I think that's really a really good point that it is a really unique and special program, and I'm very grateful that we have it here.
Thank you.
Okay, so there's a handful of questions. I don't know if the first two are actual questions, so I'm just going to summarize what I think they're trying to get at with the first one. And if you want to comment on it, cool. If not, just tell me that you
Okay.
don't want to.
Okay.
So this specific participant is, I think, just sort of asking or trying to confirm if there are supplements or any types of foods that are recommended specifically for children with autism. I think just from I'm going to make an assumption of maybe like trying to treat symptoms of ASD.
So I want to say that the answer is no. I think that omega-3 is the most common one that I hear about, but it's probably, and again, I don't know enough about it, but it's probably any kid would benefit from omega-3. But then I also know that there's questions about the integrity of omega-3 supplementation that I've heard, and this is not confirmed, but heard anecdotal reports of, yeah, after it sits on a shelf for 3 months or in a warehouse, that it's not at the full potency that it would really benefit. And that's where getting that kind of nutrition through the actual food itself is much more beneficial.
Gotcha. Thank you. This one was not a question. I'm assuming more of a statement, maybe for you to confirm, maybe comment on, but somebody had mentioned that they have heard that sugar intake can increase negative behaviors or more amplified tantrums. Any thoughts?
I should write this down. So I don't know. I mean, I look at my own children and feel that way when
Yeah.
when they're acting all kinds of hopped up on sugar after having a bowl of ice cream or something. And I don't buy the sugar free. But it'd be an interesting study to look for if it hasn't been done.
Okay. Oh, we got a couple more rolling in here. Here we go. Ready?
Okay. Cool.
Do you have any information about toddlers' diarrhea or sorbitol intolerance? We were told that their child had it and they tried to eliminate sorbitol. I'm hoping I'm saying that right. But there's still intermittent issues.
It's not something I'm familiar with.
Okay.
But if
Next
you
one.
haven't, consult with a GI, but it sounds like maybe you have.
Got it. Oh, we have somebody who said that they were the pop from Pittsburgh. So I found somebody that they were able to confirm for us. That's so cool.
Thank you.
Okay.
That's the key takeaway from this
Yeah,
presentation.
right? Their question is, what are your thoughts on pica? And you might want to maybe describe a little bit about what that is before you talk
Yeah.
about this. And is this a nutritional disorder or is it sensory? I feel like they've heard both. My son does tend to try eating paper and non-edible items.
Okay. You've kind of answered the question in the question, or at least given my answer. So here are
This is
my
true.
so there's theory. So if you're not familiar with pica, it's eating non-edible items. So it can be paper, it can be dirt, it can be gnawing on drywall. When I years ago when I was a technician, I think I had a kid who used to chew on the drywall. Um, so there's been theory, and I don't know if it's ever been confirmed, so don't hold me to this, but there's theory is that it is, a child who's trying to meet a nutritional need that's not meeting it with their diet. That being said, I am a behavior analyst, which means we always look at the function of behavior. So whether that's to get something or get attention or get out of doing something. And I have definitely met kids who have been given a directive like, go get your shoes. And then they start chewing on the shoe. And the parent is like, oh, pica. But really, the child figured out, hey, this is how I got your attention for you to put the shoes on me, and I don't have to do it myself. So it's entirely possible that there's a behavioral function, or it could be that automatic, that sensory function of, oh, I like how it feels when I chew on the shoes.
Um, this is a comment, but thank you for the presentation.
Mhm.
And the question that I would like to answer is, and there's a couple more, Ben, but this one came up next.
Yeah.
Do we get access to this recording or presentation? So this is recorded and it will be sent out probably in about a week or so to all participants that registered, which would be you. So yes, you should just keep an eye out for that. It should pop up for you. If not,
Do
please
we
reach
post
out.
these on our website anywhere?
I'll have to check in with our marketing team. I'm not certain if it's posted on the family corner or not, but I do know that all participants that register, even if they don't attend, do get access to it.
Okay.
Next question is, can a child access the feeding therapy services at Verbal Beginnings without receiving ABA therapy there as well?
Yes. Yeah. And we actually, I don't know if you're getting at this, but we do work with children that don't have an autism diagnosis. Insurance can vary whether they approve it or not because we're billing ABA codes, and ABA is historically associated with autism, at least in the insurance world, though globally we know it's really used for so many different things, but insurance hasn't gotten there yet.
Another question, and this sort of goes back to one of the first questions. So again, this might not be something that you want to answer, but just tell me to move on if not. Specifically asking if mushrooms have been shown to increase attention and focus, if you know.
Well, I don't have an answer to that, but I can say that I have never heard of that one.
Okay. Next one. Um, Somebody had mentioned this is going back to bowel movements when you were talking about it a little bit earlier. Again, it might not be something you feel like answering, but comment on, let me know. Their toddler is experiencing about 2 to 3 large bowel movements per day. Is this concerning? Recommendations, thoughts?
I think it depends on the variety of food accepted and the volume. If the child is prone to consuming a good amount of volume, then I wouldn't be concerned. If it's a healthy formed stool and that if they're not difficult to pass, I probably wouldn't be concerned.
This is a cool question for you. Could you provide, not that all of them are not cool questions, I appreciate everybody's questions, but I think this is a good one as we're wrapping up the hour here.
Mhm.
Could you provide 3 to 5 strategies in mind that you have that you would tell parents from the get-go when they ask you how to support their autistic child with food selectivity?
Yes. So I will preface this with, I guess what I said earlier is there's a lot of variability, right? Like some kids just kind of quietly say, no, I'm not going to eat it, and are like really polite about it. And then we have kids that like throw the spoon at your head. But considering that, you first step is to start small. So if that is let's say chicken nugget is our target food, taking like a dime-sized piece of chicken nugget and cutting that in half and starting with that. And if your child is willing to eat that, great. Don't ask them to eat another piece. Wait until the next day and then maybe try 2 pieces instead of one and see if you get the same success. So common failure that I see is that, the child might be willing to try the food one time, and then the parent is so excited, and rightly so, and that they say, okay, well, now eat another one. And do you like it at all? And the child is just overwhelmed, and they're like, nope, forget it. I'm never doing that again. And in that sense, looking at it as a behavior analyst, that attention that the parent was providing and hoping that, something good was happening was actually a punishment because the child said, no, I'm not going to do it anymore. Other strategies you can consider are offering some kind of reward. I think this is really important to establish that the idea behind a reward is to get rid of it over time, so that it shouldn't be to get your child to eat that piece of chicken nugget that you should be offering the iPad or bubbles or a sticker or a video for the rest of their life. That shouldn't be the case, but maybe to kind of get them motivated because the chicken nugget's not motivating yet. That's a good start. And when I have families that say that they're resistant to offering that because the child should just eat, I sit there and I go, yeah, but they're not eating, so we gotta offer them something. Just like you probably wouldn't work without making a paycheck, but it would be nice maybe if you did. Other things you can consider, just quickly here, are starting with reintroducing foods if you have them, foods that your child used to eat. And sometimes it can be helpful. I know the biggest thing I hear from families, and this is not every kid, but the most common thing I hear that is eliminated with autism is vegetables. So many families that come into my clinic and say, don't eat any vegetables at all. So you can start with a vegetable puree. I know some people are against that idea, but it really does help if you did like a small spoonful of like broccoli in a smooth form. I don't know why. I don't know if it's just easier to swallow or it's less scary looking than an actual piece of broccoli or a green bean or whatever it is you're doing. And you can puree pizza, by the way. But that can be a helpful strategy, just trying to make the food in a simpler texture.
Thank you, Ben. We're at 6 o'clock, but there's just one more thing here.
Yeah.
Again, I think a quick one. Just somebody asking if you have any thoughts on B12 supplements.
I don't know enough about B12 supplement, but I do know that you can over supplement that. So again, I would seek consultation with an expert as to the proper amount of that. And that might be that a dietitian looks at your child's size, their body weight, and height in order to determine what's an appropriate amount of that supplement.
Awesome.
So something that I'll just kind of wrap up with here, and I think back to the nutrition class I took in college. It's easy to over supplement and not necessarily have toxicity or a problem because the body is really good at getting rid of excess. And so that's where I think of my professor saying, you can take a multivitamin every day, but you're literally putting your money in the toilet because your body can't absorb all of that. And that's where, maybe taking the multivitamin every other day might produce the same kind of benefit. And then it's not just leaving the body. I think I saw that there were 2 other questions. So if I'm good to stay,
Yeah.
if people need to go, don't let me hold you, but I'm happy to answer those questions.
You know what? I think we could stay. I would stay here all day. But what I do want to say is if you could flip to the last slide while I
Oh,
look
yeah.
at that and talk about that really briefly, take a look at the question that's in there, Ben. And maybe while they're looking at what's on this slide, you can answer that last question for us. So everybody, for our next month, November 12th presentation, a really, really neat opportunity for us in Verbal Beginnings. We have Lisa Frank and Andrea Bennett from the Special Kids Company. They do advocacy work for kiddos who have IEPs or are looking to go through the IEP process. They'll be presenting on understanding the special education process and essential components of IEP. So please join us. That's going to be a really great presentation.
I can't open the Q&A to see the question. So
Oh, I'm so
a
sorry. I didn't realize.
question, I tried. I'm sorry.
Sorry about that. Okay, to wrap us up, last question. It's a good one. Could you please break down the process or what it looks like when families go down the route of using ABA as food therapy. What are they expected of for the analyst to work on? So maybe just a quick summary of that.
Yeah. So, I mean, most of the kids I meet are food selective. We do have some kids that are like total food refusal and will only take like Pediasure supplement. Um, and then we do have kids too that have never had food in their mouth before and they're on a feeding tube. So I think the important thing to know is that there are other approaches out there. So like there's play-based therapy that's typically done by like an OT or a speech therapist, or sometimes a dietitian will do it or a psychologist, but it's not very effective. And it so often the kids that I meet that have done it have just learned, all right, I play with the spaghetti, but I don't actually eat it. And then when it's time to eat it, the child's like, no. But then there's also the sensory approach, which I'm hugely critical of because it's making a lot of assumptions about this invisible force, which if you've attended my other webinars, I love to talk about how it's supposed to be out there. And it is. There's sensory components that we all have. But basically it's become this kind of blind intervention of rubbing faces and vibrating brushes and tongue stretches that there's just not any science to support or not any good science to support. So I meet those kids too in clinic, and that's where we really look at a behavioral approach, which is about prompting, waiting, and then reinforcing desired behaviors. So, for example, um, if I have a child that's, sitting at the table and refusing to eat the broccoli, we kind of just wait. And so we might wait like 10 minutes. And if the child throws the broccoli on the floor, we'll just get another piece of broccoli and say, well, let's try again. So it's just a matter of kind of patience and finding the right strategy and teaching the child to trust you, the therapist, to learn to eat these new foods. And then we teach the parents to do that at home. And hopefully, if there's somebody willing at the school to follow through at lunchtime, we'll teach them too. But ultimately, I describe it, especially for our kids that have autism and are more routine oriented, as developing a new meal routine that's more functional. And it can be for some kids, it's a little uncomfortable leaving that initial routine. But once they get to the new routine, it tends to be more predictable. And we see kids that actually much prefer the new routine because mealtime is less stressful. And parents are usually much happier too.
Awesome. Ben, thank you so much for this wonderful presentation. It's always such a pleasure to have you. And there's so much engagement and so many people that have joined us this evening. So I'm sure everybody, hopefully I'm speaking on behalf of everybody, but thank you so much for this wonderful
Yeah,
content.
no, I appreciate everybody
Okay.
commenting and questioning because it makes the presentation a lot more easier for me rather than me just kind of talking.
Yeah, no, this was really great. And thank you to everybody for attending this evening. And for those of you that stuck around for a couple extra minutes with us, we really appreciate your time. I know we're all very busy. So thank you, thank you, thank you. And we hope to see you at some future webinars. And Ben, I'm sure we'll have you back within the next couple months again. So thank you again. And I hope everybody has a great evening.